Rabies can also be transmitted or spread by other means apart from dog bites.
Okay.
Okay. So this is through aerosol transmission. That is, when a patient is in the hospital, is having the disease, and the doctor is taking care of it, being managed. If the patient coughs, it forms an aerosol droplets in the air, and if the doctor is not careful, it will inhale the droplets, and then the droplets will sit on the mucous membrane of the nose, and you will get the disease.
I understand cats, not only dogs, but cats also give the disease rabies.
Yes, they do. All carnivorous animals are potential, sources of the infection.
And how is one infected?
If you look at people think it is a disease which passes through the blood system. No. When you get the disease, when you are bitten by a dog, the virus has a high affinity for nervous cells. It enters the nerves and it is carried by the nerves to the brain. It is when it gets into the brain that you are identified as a rabid person or animal. So it is the fact that it passes through nerves and it bypasses the blood system and enters the brain. And when it gets into the brain, it also has specific cells that it attacks. We call them hippocampus and Purkinje cells. These cells are have a high affinity for the virus. And then from there, from the brain, it then goes into the saliva. And it is the saliva that contains quite a high amount of the virus. So that when the dog bites, it is not the bite alone, it is the bite and then the saliva that contains the virus. Infected person barks. It will bark like a dog. Actually, what happens is that initially the disease is just look like a flu disease, malaise, fever, or headache. Then later on, you have you feel some pains where the bite occurred, some pains, some discomfort at the site. Then the delirium, hallucination, aerophobia, that is fear of air. I mean, you try to avoid air. When somebody is blowing air on you, you try to avoid it. Then also hydrophobia, because the disease paralyzes the throat. Paralyzes the throat. When you are trying to drink water, it triggers the spasm of the throat, and therefore you fear to drink the water.
Right. Now, looking at the symptoms that you've given us, I understand that within 10 days, if you are infected, you may die. What cure then is there for rabies? Rabies has no cure when it enters the brain. The brain also has a blood-brain barrier. Blood-brain barrier, so you cannot even treat it if you have a treatment for virus, a treatment for rabies. There is a tight junction at the brain where there's no, it doesn't allow even antibiotics and other things to go into the brain. Okay.
Now, what happens is that it destroys nerves that go to the respiratory system, and it causes what we call respiratory failure.
Okay. Who are the most vulnerable to
the most vulnerable
disease?
are children under the age of 15 years.
Okay.
This is because there's something we call the neural path. The length of your neural path from the brain determines the incubation period of the disease. And therefore, when you are beating the neck, the leg, and then the face, you are likely to get a disease within a very short time. Stray dogs are reservoirs.
Okay.
And when you say, when you see dogs, they are 4 categories of dogs. Dogs that are owned and not restricted. That is, people, they are always in the premises. There are dogs that are not restricted, but they are also in the house. And then we have community dogs. These are dogs that protect the community. Now, stray dogs are different. Stray dogs are dogs that move from one community to another. And these are the dangerous ones that we have to take care of.
Especially from our kids.
Yes,
all right. Kids, yes. All right, that will be all that time will permit us. Thanks so much, Dr. Nathaniel Yeboah, specialist in veterinary epidemiology, for the insights on rabies. And remember that if you are bitten, you should make sure that within 10 days you get a cure.
Can I make a...
Well, time wouldn't really permit us.
You have to wash every bite of wounds with soap and water.
Okay, for
yes,
prevention.
Very, very important prevention.
Sure, okay.
Anytime you are bitten by a dog, immediately forget about the dog and wash the bite with soap and water
before you go
to the hospital.